Last week, I answered some of the most common questions that I get asked, but it simply was not enough to answer all those questions in one video. So today, I'm gonna go over some more common questions that I get asked. But if you wanna watch that first video before you watch this one, check out that link in the description below. So the first question I wanna cover today is fluoride safe? This one has been a big topic, and it's gonna be a big topic for a while. We see RFK talking about it, and we see so many TikTokers talking about it, and we're seeing so many cities now vote whether or not to keep using fluoride in their drinking water. Now, the funny thing about this controversy is how polarized it is. On one end, you have people that strongly support it and advocate for it and want more of it in their drinking water. And on the other end, people are doing the exact opposite and want to get rid of it from everything, including their toothpaste. Now, there are some people in the middle also that want to try to find some middle ground, or people that just don't care. Now, what I found is usually when people are bringing this up to me in my office, there's really no debate to do because people are already set in their ways, whether they want fluoride or they don't want it. And I also don't have time to debate someone whether or not they should be using it or not. So if someone does ask me about it, all I can tell them is the facts, and then whatever they want to do is up to them. The fact is, fluoride is safe. To keep it simple, fluoride is safe at the dosages that we use in the United States. The CDC wants to keep it at 0.7 parts per million in our drinking water. In other words, that means 0.7 milligrams of fluoride per liter. Now, at those concentrations, it has been shown to be completely safe in our drinking water. And I can say that with confidence because we have studies dating back almost 100 years on this. Now, the same thing goes with toothpaste. There's a lot more fluoride in our toothpaste, but we're not supposed to be swallowing or eating our toothpaste. And you might say like, oh, what if I accidentally swallow some toothpaste? Like, there's no way I'm supposed to be able to spit every single bit of toothpaste out. Well, that's okay. This is from the National Institute of Health, and it found that the estimated amounts of fluoride ingested from toothpaste are 0.1 milligrams to 0.25 milligrams for infants and children up to 5 years old, 0.2 to 0.3 milligrams for children 6 to 12, and only 0.1 milligrams for adults. So the moral of the story is you're not supposed to swallow toothpaste, but if you swallow a little bit, it's not going to hurt you. But what if you accidentally swallow a lot of it? Well, the lethal dose for fluoride for an adult is extremely high. It is about 5 to 10 grams of fluoride in one sitting. So let's take the lower end of that, the 5 grams. And let's say you are a 70 kilogram or 154 pound adult. You would have to swallow 3.5 full tubes of toothpaste in one sitting. And that's assuming you're using a typical 100 gram size of toothpaste. But the point still remains the same. You should not be swallowing toothpaste in the first place. And I even recommend for my patients when they're asking if they should use a fluoride toothpaste for their kids, I tell them only do it if their kid is able to spit the toothpaste out. Otherwise, just stick with the fluoride-free one. Now, you might have come across some studies or some TikTok or someone talking about how fluoride is a neurotoxin, how fluoride lowers IQ, how fluoride is a poison. Now, first off, anything can be a poison. Water can poison you. If I eat enough multivitamins, it could be poisonous. Anything can be a poison at the right dose. But from what I've just showed you, the dose to be poisoned by fluoride is extremely high, especially compared with the amount that we're actually receiving. And in regards to the studies that show that fluoride can cause these problems, there are a few problems that I see with every single one of these studies. One, they are usually a correlational study, and the sample size is super small, meaning it is very weak level evidence, and we cannot draw any sort of causation from it. And also 3, the levels of fluoride in those studies are way higher than what's being regulated in the US. I'm strictly talking about the US levels of fluoride. There are cases in other countries where we see problems from having too much fluoride in the water, and that's because it is unregulated. In fact, in some areas of the US, they actually remove fluoride from the drinking water. Fluoride is naturally already occurring in our water, so they just keep it at that 0.7 part per million. This has been studied many times for many years, and it has been proven to be safe time and time again. Now, the second most common question I get asked while we're on the topic of some sort of controversy is root canals. Just like with fluoride, I get asked, are root canals safe? Now, this one is kind of sad because even last week, I had a patient that needed a root canal in order to save her tooth, but she saw something online and she was adamant that she wants to get the tooth taken out. Now, she didn't tell me why she wanted the tooth taken out. She just told me she didn't want to do the root canal. She wanted to get it taken out. She didn't tell me anything about what she saw, and I didn't really want to question it too much. If this is what the patient wanted, after I presented the options, then this is simply what I do. But after I took that tooth out, a few days later, she really told me she regretted that decision of taking that tooth out because now she has to spend a lot more money on an implant in order to replace that tooth because she doesn't want to have a missing tooth there. And she also told me that she feels like she got tricked by some of these videos that she sees online, basically telling people to never get a root canal. Now, if you don't know what a root canal is basically if you have, let's say, a big cavity in your tooth. Cavity is a hole with bacteria in it that gets inside of your tooth. If that cavity gets big enough, it can get inside of the nerve inside of your tooth. Now, this can be really painful. It can cause a lot of inflammation, it can cause an infection, and what we do typically is we clean out that cavity and then we clean out the nerve. And we do this by putting these files inside of the canals inside of your tooth, and then we put this disinfectant. We literally put bleach in those canals to really clean it out, clean out any nerve tissue and clean out any infection. Now, root canals have been shown to have a long-term success rate between 90 to 95%. If you're wondering why it's not 100%, well, nothing is 100%. Nothing in medicine, nothing in dentistry is 100%. Now, if by small chance the root canal does fail, what it'll look like is typically it will have an infection or the tooth might still be symptomatic, and we will typically see this on an x-ray as well, and then the tooth will probably have to come out. Now, it can get a little bit more technical, but I don't want to bore you with that. Now, where this whole controversy started about whether or not you should get a root canal started with this Netflix documentary called The Root Cause. Now, keep in mind, that documentary got taken down shortly after because of misinformation. But that didn't stop people from creating these conspiracy theories. In fact, it actually made these conspiracy theories even stronger. People claim that the big dental or big endodontics, which are root canal specialists, actually are the people that took this down and lobbied for this and paid a lot of money because otherwise they would have lost a lot of money because people didn't want to do root canals anymore. And then we got people claiming online, and actually some dentists, or what I call dentists, claiming online that you should not get root canals. Instead, you should do something else, which they don't really have another option other than doing dental implants, which cost a lot more money. Now, keep in mind, before I go more into root canals, if you decide to get the tooth taken out and get a dental implant, that's perfectly fine. Dental implants are also very predictable and have a very high long-term success. The only problem is you still have to go through a surgery. Now you're actually removing part of your body, which can be traumatic, and you're gonna lose bone. And then you have to go through another surgery to actually place an implant or a foreign body inside of your jaw. And the implant is never gonna be as good as your natural tooth. As much as people like to claim that implants are great. Don't get me wrong, implants I think are great. I think they're a great option when people have missing teeth, but it's never gonna be as good as your natural teeth. Now, the reason that people claim that you should not get root canals, and what this Root Cause documentary was claiming, is that when you do a root canal, you're leaving a dead tissue in your body. Imagine if your liver died and you leave that dead liver, or if you have a dead kidney and you leave that dead kidney in your body. You could see how that could be a problem. You would probably have an infection, your bacteria would probably start attacking it, your body would probably start attacking it, and it could really make you sick. The difference with a tooth is when you do a root canal and you remove that nerve inside of the tooth is still functioning. It's still remineralizing. It's still acting like a normal tooth. How do we know that? Because we have actual studies showing that. And we find that when we do successful root canals on people, it works, and people have no other systemic problems, at least because of that root canal. But going back to this documentary, and what some of these other fake dentists like to say, is that if you do a root canal, it will lead to more systemic problems, like more likely to have cancer, more likely to have heart problems, etc. The only problem is there's no studies backing this up. In fact, all of the data from these type of claims have been really outdated. They are more than 100 years old. Now, if you're using some sort of data over 100 years ago to back some sort of claim of what I should do with my body, when we have long-term studies that are more recent and more dated and better quality studies, we have to trust the better quality studies. For example, one of the claims I saw from the study was that 98% of people who have breast cancer have a root canal on the same side of their body. So for example, you have breast cancer on the left side, you have a root canal also on one of the teeth on the left side of your mouth. First of all, this claim is not true. There's no evidence to support this claim. But they were able to just blast this claim out on this documentary, which people can still watch, just not on Netflix. And also the fact that they claim that the breast cancer has to be on the same side as the root canal is not based on science. That's based on something called the meridian system. This is basically like traditional Chinese medicine, which I don't really have any problem with this like old traditional medicine. I do think it has its benefits, but there's just no proof that it works. And unfortunately, when we do medicine or dentistry, we need proof that something works. Now, one of the major other things I find people talk about with root canals is you can never fully clean inside of a root canal system. Now, before I go on, I did go more in depth on specifically root canals and fluoride and going over like some of the statistics and actually showing some of the data. So if you want to learn more about that or actually watch a more in-depth video on those, I'm putting a couple other links in the description below if you want to see those. But when people say like when you do a root canal, you can't fully clean 100% of the bacteria inside of that tooth, well, that's true. You cannot. You can get close, and with our modern systems, we do get really close. But the thing is, you don't have to clean 100% of it. And we know this because one, which I think the most important reason is we have studies showing that root canals work. And two, we rely on the body's immune system as well. So when you do a root canal, you clean everything out and then you seal everything off. So you prevent any bacteria from getting inside. And if there are any bacteria that remain, this is where we rely on the immune system to take care of the rest. And the reason that this actually works is because we're getting rid of the source of that infection. Because when we remove that inflamed pulp and that infected tissue and we really disinfect that root canal, that is the whole source of that infection. Once you remove that, whatever remaining part is there actually gets taken up by your immune system. So again, root canals are completely safe and they're a great way to actually save your tooth so you do not have to do something more expensive and you get to still chew and keep your tooth for a lot longer than you normally would. And before I go on to the next one other thing I want to point out that a lot of these people on social media basically telling you to avoid getting root canals, what they do is they're actually trying to sell you on something else. So whenever someone is trying to fear monger or sell you on some sort of fear that is like against what is normal, just keep in mind what they are selling. Even if you don't want to believe what I'm saying, just at least look out for yourself and see if they're trying to sell you something else that is really expensive. Usually they are trying to sell you implants and make a lot more money off of that. Now, for the rest of the video, we're kind of done with controversy, but I do have a couple other questions. So number 3 has to do with teeth whitening. The question I get is, can teeth whitening damage my teeth? Well, to keep it simple, if you whiten your teeth correctly, it's completely safe. It does not remove any enamel. The only problem with teeth whitening is it can damage your gums. Now, I'm talking about 2 specific ingredients in your teeth whitening, either carbamide peroxide or hydrogen peroxide. Whether you use a strip or like a tray that goes over your teeth to actually whiten them, all of this will work. But you want to use it correctly. So make sure whatever product you're using, read that box correctly, or if you get it from your dentist, listen to their instructions, because if you do it incorrectly, this can cause problems. Whether if you get some on your gums, it can actually burn the gum tissue, which should usually heal on its own. And really the only other problem I see with teeth whitening is it can actually make your teeth sensitive temporarily. So if you know that you really have sensitive teeth, you want to be a little careful with it. Start with something that is like a lower dosage and maybe don't use it the full amount of time and maybe don't do it every single day. Maybe try using it like every other day and give yourself a break. And then combine that with like a sensitivity toothpaste to help out. But the other forms of teeth whitening that aren't one of those 2 ingredients that I talked about, those actually can damage your teeth. So for example, something like charcoal toothpaste. Many people think this can polish and really clean your teeth and make them super white. The problem is this doesn't do any of that. Actually, it can make your teeth more yellow because the charcoal, all it's doing is it's scrubbing the top surface of your tooth. So if you have like tartar or if you have like coffee stains that are like external, it might polish those off and it might temporarily make your teeth look more white. But if you keep using it, then it actually can scrape off your enamel and expose the dentin that's underneath, which can eventually make your teeth look more yellow. Now the 4th question I get is, why do I grind my teeth at night? So many people grind their teeth and they just don't know why or they can't control it. Now grinding or clenching your teeth is also called bruxism. One of the biggest common reasons we are told that we grind our teeth is because of stress. But now we're finding that it's not just because of stress. In fact, we're finding that your sleep plays a big component into why you grind your teeth. And not just your sleep in general, but how you are breathing when you're sleeping. Technically, what some studies are showing is you get this like micro arousal in your sleep where you don't fully wake up, but your body kind of wakes up. And that's usually because you struggle breathing. So if there's any point, like if you have sleep apnea where you're struggling breathing and you might not even know that you have this, or it might not even be sleep apnea at all, it might be just some sort of resistance in breathing. This can be like if you're lying on your back and your tongue falls back and starts cutting off your breathing and makes you snore, or if your airway just collapses. Yes, this can happen to some people. This can trigger that micro arousal where you kind of wake up, but your brain doesn't fully wake up, and then your heart rate goes up, and then eventually sends this cascade of reactions that causes you to grind your teeth. So what can you do? Well, most people don't even know that they're doing this. So if you go to your dentist and they tell you that it looks like you're grinding your teeth, a simple solution is to get a bite splint, which is like a mouth guard that goes over your teeth that basically protects your teeth. So if you do ever grind and clench your teeth, it at least protects them. But at the same time, you also want to focus on your sleep too. So maybe that involves getting a sleep study, or maybe that involves like limiting your caffeine throughout the day, or just focusing on getting better quality sleep. Now, I did also talk about how to breathe better when you're sleeping in some other videos, so I'm putting another link in the description below if you want to learn about that. Now, the fifth question I want to talk about is about baby teeth. Now, this I get a lot from parents, like if they bring in their kid and they have cavities in their baby teeth, or they have some sort of problem and we need to address it, they ask, what's the point of doing all this when the baby teeth are just gonna fall out anyway? Your baby teeth are going to fall out, yes, but before they fall out, they are like a space maintainer for your adult teeth. Because let's say you start losing a couple of your baby teeth, then the space between your other baby teeth will start to close because your baby teeth will start to drift and close that space. And that also means that your jaw is gonna be more narrow, it's not gonna grow as wide. So this can lead to a lot of crowding with the adult teeth because the adult teeth are gonna start coming in some weird positions, or they're gonna be impacted where they can't even come in at all. And if this happens, you need to get a surgery in order to expose that tooth and then pull it in the right place. So the biggest reason is if you lose the baby teeth too early, it can lead to problems down the road, more like orthodontics, and might need a surgery, like a jaw surgery, to correct everything. But also, if you have decay in your baby teeth and you leave it alone, then this can also cause infections. So just like your adult teeth, when you ignore them, they can cause infections. Same thing goes with your baby teeth. And if they cause infections, not only can it start affecting the adult teeth underneath, and this infection can actually spread to other areas in the body. And not to mention, it can be really painful for that child. So yeah, do not ignore problems with baby teeth. Okay, the sixth and last question I want to talk about is, why do my cleanings hurt? Are dental cleanings supposed to hurt? No. But it can hurt for some people. Usually dental cleanings hurt because your gums are really inflamed. So if you're not brushing and flossing like you're supposed to, or you're not going to the dentist every 6 months, you're gonna have more bacteria building up in your mouth, more bacteria building up underneath your gums. Your gums are gonna be more reddish, they're gonna bleed more easily, they're gonna be more likely to have gingivitis, in other words. And this all just means that your gums are really inflamed and really angry, and they are gonna be a lot more painful to touch. But the good news is, once you get them cleaned and once you keep cleaning them regularly at home, then they're gonna heal a lot better, and then they're not gonna be as sensitive. Now, side note, if you're a really anxious person, especially at the dentist, then your cleanings could also hurt because of that, because anxiety actually triggers a pain response in your body. So if this sounds like you might wanna ask for nitrous or a laughing gas at your next cleaning. But bottom line, make sure you keep going for all your visits. Whatever schedule you and your dentist have agreed upon, make sure you keep going to that and do not neglect it. Anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you guys in the next video. Ever wonder why your dental cleanings hurt so much? Ouch, stop poking me. Well, the reason that it hurts might not be because we're using those sharp instruments. You see, that pain that you feel when they're actually scraping and cleaning your teeth might actually be revealing something about the health of your gums. So in this video, I'm gonna break down a few reasons why your teeth are actually hurting at your dental cleanings,